All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, community pharmacist of the world, Craig. So look like we're going to answer this question here that Ms. Terrell came in with, and she said, hey, alternatives for blood pressure medication. We left off at arjuna bark. So arjuna bark is the terminalis species, and what it does is it lowers blood pressure, it lowers cholesterol, it's good for coronary artery disease, so it also appears to have an effect on plaque, and for those of you who have congestive heart failure. So I recommend it as well. It has been likened to have beta blocker activity. So those of you who take metoprolol, for those of you who take atenolol, so kind of a heart rate slowing, but also kind of a vasodilatory effect. Okay, and then the last one is coenzyme Q10, which is, I guess, most people would probably say is a vitamin. So what coenzyme Q10 does is it regulates the calcium channel. So for those of you who are on calcium channel blockers like nifedipine or amlodipine, this substance mimics that behavior and keeps the heart from contracting so hard by regulating the influx of calcium, influx and outflux of calcium. So those are my top alternatives for blood pressure: beetroot juice, L-arginine, coenzyme Q10, and arjuna bark. So make sure you share that with someone, and I'll go in depth on the page if I need to. Also, excuse me, while we're at the beginning of the year, a lot of you have weight loss goals, so we're going to talk about Garcinia cambogia. And actually, I've started back on this myself, doing my fast. In fact, my staff is also forced to do it. So, excuse me, we're going to be doing a little vegan fast for about the next 3 weeks or so. So no pasta, no bread, no cheese, which is the really hard one for me. Let's see, oh, definitely no meat. So we're going no meat as well. No processed sugar, and then of course the other one, we'll probably have to lay off the sodas and the coffee and all of that too. So Garcinia cambogia for weight loss, this helps you lose weight by 3 different mechanisms. First of all, it cuts off your appetite, and so it just will not allow you to eat as much as you are probably used to. Like I've said so many times on this show before, I'm a fairly nice sized guy. I can eat an entire large pizza by myself, no problem. But when I'm on this stuff, it cuts me down to about 1 or 2 slices. So it shuts off the appetite. The second mechanism is that it blocks an enzyme called citrate lyase. And what that enzyme does is it takes the food that we eat at the end of the day, and while we're asleep, turns those carbohydrates into fat or into cholesterol. So this blocks that reaction from taking place, and you just number 2 it on out because it's high in fiber. The third mechanism by which it helps you to lose weight is, particularly around this time, we tend to get a little depressed and we want to binge eat. Well, this has a natural antidepressant effect in it, which raises your serotonin, so you do not have the urge to binge eat because you feel kind of down. So those are the 3 ways that Garcinia helps you to lose weight. A great supplement for the beginning of the year. The reason I recommend it so highly is it is effective, but also does not raise the blood pressure. So for those of you who are on hypertensive medication, you can lose weight safely with this, and you could really do it without any exercise. We'll talk about this a little later. We're going to get back into these calls here. All right. Carolyn, welcome to Pharmacist on Call. How may I help you?
I was wondering what would be good for sinuses when you had them bad.
Sinuses, are you on blood pressure medication?
Yes,
Okay, so you're going to be kind of limited. Most of the good stuff is going to raise your blood pressure, like Sudafed and phenylephrine. So I would recommend, like the gentleman who called about maybe a call or 2 before you, a neti pot. And basically you'll have water that's being alkalinized with sodium bicarbonate or baking soda. And what it will do is clean those nasal passages, and take some of that swelling down. You could also do, like I said, the saline nasal spray, and do that as well. And then there's a medication called Coricidin HBP. So if you also have the runny nose and the coughing and the sore throat and all that, and then Coricidin is pretty much the only thing over the counter that you can use for those other symptoms. with the stuffy nose.
Okay.
So it's Coristin HBP.
Okay, thank you so much.
Yes, ma'am. Good question. Thank you.
Thank you. Bye-bye.
All righty. Bye-bye. All right, everybody. So, yeah, Garcinia, good part of our 1-2 punch to start the year off. Beetroot juice is a great one. And then these two together will go towards helping you reach your weight loss goals. So again, the diet that we're on, for those of you who are curious, no carbs. So that means no pasta, no bread, no cheese, no dairy, no processed sugar. Some people have asked me about agave. I don't see any reason why not. I'm not going to use it, so I'm just going to go pretty strict. And pretty much strictly fruit, leafy green vegetables. So like I told my technicians, if it has a mom and a daddy, don't eat it. So no meats either. Okay, let's see. We got another question here from Facebook. Deborah Beach wanted to know what she could use to lower her cholesterol. So what vitamin? Niacin can help you lower your cholesterol, but not only that, so can beetroot juice also help you lower your cholesterol. And our good buddy Garcinia Cambogia can also help you lower your cholesterol. So Deborah Beach, if you're watching, or if those of you who know her, let her know beetroot juice, niacin, and Garcinia Cambogia go a long way towards reducing cholesterol. There's also a product called red yeast rice that she can take also if you don't want to do the statin thing. The only thing is that this supplement converts into a statin in the bloodstream, so the liver changes it into lovastatin, I believe. So you'll still have to go through the monitoring that you do with statins. We had another question. Well, we got an interesting question here. So this gentleman, Ryan Medall, said he's in chronic pain. He lives up in Wisconsin. We'll get back to his question here. It looks like we've got a call here. Pharmacist on call. I may help you.
Yes, my name's Donna. I have a tongue that's sick. I've been on nystatin 100,000 units. I've been on it 3 times in the last 6 months.
Yes, ma'am.
And my tongue is still sick.
Okay.
And I was wondering if there's anything that I could get to nourish my tongue and to make it well.
Okay. So you've been on nystatin for a while. Have you been on?
Yes.
Have you been on antibiotics?
I was on antibiotics about a year ago.
Okay.
What was that antibiotic? It was a strong antibiotic that I wouldn't want to get on that again.
Okay, so it was a result of taking that antibiotic?
I don't know what caused it.
Okay.
I brushed my teeth one time with Ajax to get them white, and
Yes, ma'am.
and used some hydrogen peroxide before, and I took all the bacteria out of my mouth. But I never do that anymore. I just brush my teeth with soda now.
Yeah, thank you. Yeah, don't do that. All right, so in terms of what she's talking about is thrush, which is common when you take antibiotics. So it may manifest as a vaginal yeast infection, but sometimes it manifests as oral thrush. So have you tried diflucan?
Tried what?
Diflucan, fluconazole. Has your doctor, like, it's a pill that you take once every
No, I
3 days or
never
so?
heard of it.
Yeah, ask your doctor about diflucan. Diflucan. And so what happens is, sometimes those antibiotics can wipe out all of your flora and leaves your body vulnerable to infections from, like, Candida, like is what the thrush is. If you wanted to go natural, you could look at maybe coconut oil, gargling and brushing with that.
Gargling?
Mm-hmm. Yeah, raw coconut
Okay.
oil. I'm trying to think. Olive leaf extract also is a good antifungal. So I'd probably look at those two.
Could you spell that for me?
Sure.
The first one that you said that I could get from my doctor.
Oh, diflucan. D-I-F. L.
G.
D as in dog.
Oh, D.
I-F.
I-F.
L-U.
O-U.
L-U-C-A-N. Diflucan.
Okay.
And it comes as diflucan. And they should know. And then the second one is coconut oil.
Yeah, I got that one.
And then olive leaf extract.
This is the second time I've seen your program. I just love it. It's a wonderful program.
Well, thank you.
And that medication or that oil that you said to lose weight, what was that called, please, sir?
Oh, Garcinia cambogia. If you go to Pruitt'sDiscountPharmacy.com, all of our products are there, and it'll give you descriptions on everything. Yeah, but it's Garcinia cambogia. It comes from the tamarind fruit plant.
Okay. All right.
Okay, all right. Well, appreciate your call, Ms. Donna.
Well, thank you so much. I love your program. I'll always watch it.
All right. Thank you for watching, ma'am. Appreciate it. All righty. Bye-bye. Okay, let's see. Evelyn, welcome to Pharmacist on Call. How may we help you? Hello, ma'am.
Hello.
Yes, ma'am. How can we help you?
Yes, I was trying to find out if you could prescribe something for a slow digestive system and also for acid reflux.
Okay, so okay, let me ask you this then. Are you diabetic?
No.
Okay. So you're saying it takes you a while to digest food?
Yes.
Okay, and you have a bloating and fullness kind of feeling in your stomach?
That's right.
Does this come from you eating certain types of food or everything?
Well, just about everything.
Okay. So it sounds like this condition is called gastroparesis, and then we normally see it in diabetics where their stomach starts to slow down and they get full easily and sometimes nauseous, and that sounds like probably a little bit of what you're going through. Ask your doctor about something called Reglan, Reglan.
Okay.
And it's metoclopramide. It's what we call a prokinetic, and what that means is it kickstarts your stomach to begin churning and processing everything.
Okay, you said Reglan?
Yes, ma'am. Reglan. It's metoclopramide is the generic, so it comes in a 5-10 milligram tablet.
Yeah. Okay, then. Thank you very much.
Yes, ma'am. All right. Thank you. All right. Bye bye. Okay, so we were leaving off at Ryan Meadow's question here. So he says, is a patient in chronic pain? I guess his doctor was a little reticent about writing him anything else. He was on a regimen that worked for him, and I guess he's trying to find a doctor up there who can help him. Well, hey, I'm not up there, so I'm not able to recommend. So this is going to be something that you will probably have to, if you're on insurance, Mr. Meadow, see if they can find a chronic pain provider that is contracted with them that they can refer you to, and you may have to do it trial and error until you find one that kind of makes you happy. In the meantime, I would recommend the CBD, the hemp oil. It's gone a long way towards helping our chronic pain patients. You can use it in conjunction with your chronic pain management, or you can use it by itself if you are past the chronic pain stage, yet you don't want to get sick from not having your medicine. So for those of you who experience opiate withdrawal, don't be afraid of not coming off your medicine, because the CBD oil can help you take care of that sickness. Yeah, in fact, you won't get it. But look, we're up on another break. We'll be right back. You all stay right there.